Hi, Barney. Thank you for taking the time to participate in this interview as we dwell into the critical issue of NHS staff shortages. Your insights are invaluable in understanding these challenges. I'm aware that it's your first interview and it's completely normal to be nervous. I'm just going to ask you about 5 questions. So here we go. What inspired you to pursue your career in nursing, and how has your experience been so far?
What inspired me to become a nurse is I like to help out the individuals who are vulnerable and to make sure that the patient's care are attended and to make sure that they're back on their feet and they have a healthy lifestyle and healthy well-being back into their community.
Mhm. That's great. As you mentioned that you're working at Northwick Park Hospital, how has the staff shortages impacted your work and quality of patient care?
So the shortages
Mhm.
has affected me as it's given me stress. It also makes the nurses have stretched thin, leading to increased stress, fatigue, and difficulty in providing comprehensive care to all patients. Another example of having short staff is there are longer wait times for appointments, procedures,
Mhm.
and treatments may occur. This can affect patients' outcomes and satisfaction. Um, and an example for me experiencing this is it's given me a lot of workload and a lot of stress. Therefore, it's harder for me to finish um, my shift when I'm working.
Mm-hmm. All right. The third question is very similar to the second one, but is there like any one incident or like the biggest challenge that you have faced due to staff shortages?
There are one. Nurses are responsible for caring for higher than usual numbers of patients, leading to less time for each individuals. This could mean delays on administering medications, also responding to patients' requests. Sometimes patients do forget that there are other patients as well. So it does take a longer time for us to attend their needs. Nurses may also find it themselves to very hard to prioritize tasks and potentially leaving less urgent matters unattended as well.
All right. A lot of people have been complaining about how booking appointments takes forever. So, what's the main reason for this, and who gets priority for these appointments?
The main reason is the government does not um, fund a lot of money towards the NHS. Therefore, there are less staff, and patients do tend to call up GPs and hospitals to book appointments, but it does take longer for them to attend their appointments. Therefore, and them waiting for them to pick up the calls as there's shortage of staff, but the main priorities for the appointments are patients who are pregnant, children, and elderly. And the people who are responsible for this is, from my point of view, is government, um, as it's their duty to make sure that um, they pay enough money for the staff, as NHS is free for individuals, so it's easier for people who are not feeling well to book appointments automatically. Yeah.
Mhm.
Mm.
All right, all right. So during the COVID pandemic, which was in 2020, did that affect like your work and the NHS's ability to provide care?
COVID-19 was a big impact on the NHS and the hospitals as patients were isolated, members who were tested positive had to go home and isolate for a week. I was isolated due to COVID. But as soon as I came back to the hospital, there was short of staff, therefore heavy workload. And it was very stressful for my mental health, and it was harder for me to attend patients' need. COVID-19 was a big impact to everyone in the nursing industry.
That's great. Is there anything you would like to add, like from your personal experience?
I would like to add one from my personal experience is that student nurses do a lot of work and show kindness and always ready to learn new skills, and they do have potential. However, it is very hard for students to do long hours, and they don't get paid for it, even though it is a rewarding job, and a rewarding experience. But the government should put some funds to students, and also the hospital, as nurses, carers, doctors don't get paid a lot of money, as their job is a rewarding job, as I said. But yeah, government should mostly pay attention to students who work there for free, and it's just to make them more motivated as well.
Mm-hmm. Got it. All right. Thank you so much for removing the time and doing an interview with us.
Yeah.
I'm gonna end the call right now,
Yeah.
and hope you have a great day.
You too. Thank you so much for this opportunity. I hope you have a great day too.
Thanks, Barney.
Thank you.